Welcome, everyone, and thank you for joining us. My name is Susan McNeil. I'm the Associate Director of Guideline Implementation and Knowledge Transfer, and I'm really happy that you've joined us today. And what we're doing today is we're looking at what were the key issues of 2021 and what is some collective action for all of us for 2022. So this is kind of the plan for today. And so we'll, as all of you know, I think, Dr. Doris Grinspun, our CEO, always hosts these events and is here to hear you, here to share the great work that we're doing to try to make a difference on this pandemic. And is always really up to date with what the key issues are. So she's a really important source of knowledge for all of us. So we're delighted that Doris can lead this webinar today and talk with us about some of the key issues of 2021, provide us with some updates on the Omicron variant that I think a lot of you are probably eager to hear. And then we'll moving forward together in 2022. As always, time for questions and answers, and then end the session today with a reminder of some of the ways that you can be active in 2022 and even before the end of the year for our collective action on the topic of COVID-19. So Doris, are you okay with us starting with this word cloud? If Olivia can put this link in, and we wanted to kind of start with you and hear what you think are the key issues.
It will be interesting. I want to see if there is more than one word at least.
Yes.
If 2021, what were the key issues that you faced? Not only that they were big for nursing or for the world or for health, but that you faced on 2021. I think that's a brilliant idea, Susan, to see what.
Yeah. So if you look in the chat box, Olivia has put a link to what we use often as Mentimeter to create a word cloud. And you have the option of putting in 1 to 3 words that reflects your answer to these questions. What were the key issues of 2021? So if I can just have someone else, and you actually put right in, so thank you, Corsita, you can put it in the chat box as well, and you can also put it on that link in when you click on the link and see your words join other people's words. So again, please click on the link. Now, can I just have someone who's not me, who's able to just make sure, tell us, are you able to access the word cloud? Okay, because we need to make sure there aren't any problems with the text.
And also, if anybody wants to share in the chat box, I'm happy to transfer it over to the word cloud.
Okay, thank you. And Kristen, you're confirming that you can access it fine. Thank you, Kristen and Patricia, for confirming that. And then Olivia, maybe would you be able to bring up the word cloud in just a moment if I stop sharing my screen?
And give me access again to the video, Susan, please.
To the video, Doris, or
to the camera.
Yes, Doris, you're a co-host, so you should be able to have it again. You should have it, yeah.
Okay, no, it's, yeah, thank you.
Okay, great. And Olivia, is that all right if you show the word cloud on your screen, if I stop?
Sure, yes, sorry, I'm just inputting some of the chat box words.
Oh, okay. Then maybe in that case, let me see. I'll just see if I can pick it up. And this is good because it gives us an opportunity. Oh, here, no, I can see it. I can see it. Let's just see. I will, actually, I will just go back to you, Olivia, to share it on your screen if you don't mind, because that's not working for me.
In the meantime,
and the link,
some of the words that are coming through are mental health, flexible, decline vacation due to staffing shortage, fear, mismanagement, anger, Omicron, income and social connections and isolation, connection and reconnection. Oh.
Thanks, Regine.
Susan, can you send me the link to the final word cloud? Because I just have the one to the words, to enter the words.
Okay, so maybe what I'll do is, oh, there it's coming up. I will share my screen again.
Okay, perfect. I'll keep inputting everyone's words.
That's good.
And Olivia,
Okay, here we are.
Remember to tape the session. These
Yep, it's recording.
Really, really helpful.
Yep, it's recording.
Yeah, so now can
Wow, look at that.
Can you
look
see
at
it?
that.
Yeah. Mm-hmm.
I want to take a picture of that. That's pretty something.
Oh, look at that. Health system crisis, paid sick days, misinformation. Wow. IPAC.
It really has been quite a year. Exhaustion, I'm seeing, is getting kind of big. Confusion.
Burnout.
A few more in the chat, tenacity.
Oh, thanks, Heather.
Vaccines.
Vaccine inequity and system transformation.
Yeah.
And then just to remind everybody that the larger the word is, the more people put that word into the cloud.
Oh, look at how big uncertainty is. Wow. Fear.
I can't believe that COVID is such a little word. It got lost in between all the rest. Interesting, the reactions to it.
Yeah.
Something.
Oh, vaccines got bigger. So did COVID, Doris.
so got misinformation and uncertainty.
Yeah.
No kidding. Yeah. Look at that. I think it's so good, this word cloud.
I love it. I like this closed public washrooms, lineups. I don't know if lineups is there, but
this.
Well, and it's interesting to see the social connections. There are some positive things in there as well as resiliency. I think, Heather, you were saying something similar.
Someone wrote something that is very important in the literature, and we can do another webinar all on it. The issue of mistrust on government. It's an international phenomenon. And it is, just so you know, when you read the literature on two issues, the connection between the far right and the anti-vaxxers movement, and I'm not talking vaccine hesitancy, I'm talking anti-vaxxers movement, they drive on the issue of mistrusting government. And the results are what you are seeing in the elections in Chile, which I think I mentioned to a few, where the extremes start to gain more momentum, right? And it's happening a bit in Europe and in some other places. It's something to watch in a significant way. And it's very interesting. Someone mentioned it. It is a phenomena, right? It is a phenomenon. And some try to take advantage of the phenomena rather than understanding that mistrusting government, whichever is the government, is never a good thing. You know, it's never a good thing. It's an institution. Institutions exist for a reason. We can shape what they deal with, what they connect with, what they answer to. But to thrive and build on mistrust on government is not healthy for societies in general, right? When you look, meanwhile, that people continue to put wars, when you look at wars and what has driven wars many times, right? So they fit into this mistrust, and then boom, right? Yeah, it's someone mentioned that, and it's real. No social distancing, resilience, backlog of surgeries, no kidding, it's brutal. I feel for people that need procedures and surgeries. I just think they are the collateral damage of this pandemic. Yeah.
I think the wheels are really starting to turn for people because there's all kinds of new words popping up in the chat box as well. So this has been a really great way to start this webinar, to set the stage, and Olivia can continue to plug in your words, and maybe what I'll do is just go back to the slides in just a moment.
Wait, don't go yet. I want to take one picture.
Sure, yeah.
Yeah, because it's a very good one to tweet also.
Yeah. We encourage others to tweet as well. This is a good opportunity right now to on your own Twitter handles, or you could retweet what Doris.
Do we have any of our staff that tweet?
Oh yes, we do.
Yeah.
Okay, so I'm talking about Raul or Rene.
Oh,
will be great if we can capture, if they can tweet this. It's quite something. It's quite telling, huh?
Yeah, I've got it.
Thank you, Renee.
Fabulous, fabulous.
Yeah.
Look, loneliness, anti-masking, anti-vaxxing, RNAO advocacy. Thank you. RNAO update, thank you. It's nice to see it there. I hope it was not an RNAO staff that wrote it. Anxiety, chaos, science, health system crisis. Wow, burnout.
I think the book and rebook is quite positive.
Yes.
Discrimination. Thank you, Maria.
Nice attendance, by the way. 80, 85, almost 90 people. That's nice.
Yeah, great.
Beautiful.
So Olivia just wrote in the chat box, you can keep the words and thoughts coming, and we'll continue to update and reshare at the end of the webinar.
Good. And then at the end we can see it. Thank you.
Yeah, great.
That's
so I'm going to
lovely.
stop sharing this now. Thank you everyone so much. And you might have more to add as we progress today. So I will just share my screen once.
So I want to update you. I don't know, Susan, if you heard that at 2:45, I need to be out for like 10 minutes for an interview. So I will be the before and after.
Okay. All right. So just maybe what we can do then, so 2:45, so that's in the next half hour. So that's great. So these are some of the key issues, Doris, that you had identified that we might start to talk about today. And I'll just let you take from here, and then we have a few slides to share as well.
So I will talk about each one of them. Okay. So first of all, where we are heading with Omicron, don't move yet because well, that's fine. Then we will go back to the slides. That is pretty clear, and I don't know if you read some of the information that we were sharing yesterday. Probably the best article that I have read as of yesterday is in the New York Times. A very, very good analysis. What's coming out of Africa, and one needs to take with a grain of salt what's happening in Africa, because in Africa, the population, the population is younger, but also because of AIDS, by the way, and many other reasons, right? People die younger. But also in Africa, many people contracted the virus, as you know, right? So the fact that one of the aspects that seems to come is that it's less virulent. I would hold my horses on that one. What is clear is that it transmits a lot faster, apparently between 2 and 2.5 days. That even if it's less harmful, when you have a large denominator, and what I tweeted last night is that denominator is well above 2 million here. If you take kids, right? Kids up to 5 years old are not eligible to be vaccinated. And then from 5 to 12, the vaccine is rolling out, as you know, nicely, but it's still there. And then from 12 and on, you have, which are the eligible people for quite some time now, You have a good percentage that has been double vaxxed here in Ontario, but certainly it's not 100%. So when you take everybody that has not been vaccinated, period, right, it's still, I think I put there like 2.5 million people. So even if a small percentage of those get the virus, and then even if a small percentage of those get really seriously ill, our ICUs, it is my prediction, come January post-holidays, because we haven't put enough restrictions. And I'm not talking lockdown, but I am talking restrictions on size of gatherings. I think our ICUs will be full. The problem is and Delta is not gone, of course, right? So will Omicron take over Delta? It appears that yes. You see what's happening now in the UK, that is calling an emergency and is calling the army to support with vaccination and et cetera, et cetera, et cetera. So the situation is pretty serious. Why have we not taken more measures on the following is unclear to me. And the following is this. Number one, to roll out the third booster vaccinations now, not on January. They should happen now, and many of us are pushing for it. I'm talking about the boosters. Why have the rapid antigen test not be made way more available, free of cost, which is free of cost, but you know that you could pop into any pharmacy, or that in many other places, the vaccination clinics, etc., and you could walk out with your rat with you, especially for those that will be visiting with families, that will be visiting older people during the holidays, given that we have not put any restrictions. I don't know either, because the province did get and has those rapid antigen tests. They got it from the feds. So why is not being made available much easier? I am not sure. I know that some schools will be sending their kids home with 5 rapid antigen tests to take to their homes for themselves in case they need to go to visit grandparents. I do not think that this is in all the schools, because I know just from a couple of RN colleagues yesterday that they said to me that they had gone and bought for $40 the test, because the kid actually had been with another kid during the weekend, that all of a sudden they knew it had tested positive. So not everybody can afford the $40. And people wrote in the word cloud the issue of equity, and that is a serious issue. So here you go. Someone says, I got the rapid antigen test in Ajax High School. So yeah, so is on and off. So I'm not sure. And the same is that a few public health units have put restriction numbers on gathering. The province has not moved there. So it feels a bit, and we have at the end, and don't move the slides, that the word sluggish reaction. Almost it feels, with the exception that thankfully we have vaccines, it feels a bit like last Christmas, guys. It was too little, too late, too little, too late. And then after Christmas and after the holidays and after the gatherings, you saw what happened with our ICUs, the third wave. I'm afraid that the same will happen after these holidays. As you see, there are major events, both in sport events that are coming. There are major events in all the churches, as you are well aware, people singing in choirs with no mask, no social distancing, young and old and in between, all mixed together. And most people do not have the third booster now. So am I concerned? Yes, I am very concerned. Am I concerned about what it will mean In the community, yes, I am. I am concerned what it will mean in nursing homes. Yes, I am, because in nursing homes, not every resident is vaccinated by a choice of their own or of their family. And Omicron, you know, doesn't ask permission to get people. So while it may not be a very, you know, virulent, so to speak, virus, it doesn't matter if you have already complications because you are with multiple conditions or immunosuppressed or etc. So that's, I think, one aspect. You can see when things are serious, I say, when it's not only a David Fishman raising the alarm bell or a Doris Grinspun that usually raises the alarm bell ahead of time in purpose, but when you can see a Dr. Bogosh, who was yesterday in the news, and I have never seen him so exasperated, quite frankly, on saying that we are moving late, and incredulous in the way that he was saying, I don't understand, right? And that refers to the issues of, again, third booster, rapid testing, shrinking the number of people that can gather together, ventilation in the homes. I mean, if days are very cold, you can open windows, and ventilation is critical. Because I wanted to leave this webinar, 100 people in this webinar, saying that, not just understanding, which I hope you do, but saying it to others, that COVID-19 is aerosol. People are still not talking about that. I went to an eye appointment, and you know that they come this close to you, right? Well, you know, the ophthalmologist was with a mask that is, you know, flimsy it can be. Everybody in the office, I went actually to 2 appointments in both offices. It's the blue mask, the surgical mask, hopefully level 3, who knows? I was with my N95. I don't go without that anywhere. But, and I think we need to impress upon people. The reason that they are not mentioning the issue of aerosol is very simple in my view, why WHO or governments don't announce it. And it's because, number one, they're not willing to give N95 to everybody. Number two, they may have lawsuits on their hands, more than what they have already. But number three, the piece that I simply do not understand is that they're closing factories here in Ontario. The factories that we opened to produce masks in the middle of this pandemic, all of a sudden are being, some of them closed in Mississauga and other places. And that I don't understand, because this is not over, not even close to being covered. So that's what we know about Omicron. I put some of that on the blog last week. I am going to put another article with the latest on Omicron this evening. It will go tomorrow. And we will move from there. Maybe I stop for a minute with some questions, or we go at the end with questions, Susan, whichever people prefer.
Sure. I think I'm seeing more comments in the chat box right now than questions.
That's good. Okay.
Yeah. So in terms of some of the other things that we wanted to talk about, do you want to talk about vaccine justice?
I do.
Nursing health? Yeah.
I do, and I will tell you why I do. I don't think that people really understand the concept of why vaccine justice is not charity. And those are the words of Dr. Tedros. Vaccine justice is not charity. And why Omicron is a vaccine injustice variant. And that's not Dr. Tedros, that's me in the last blog. We would not have these mutations if the great majority of people were vaccinated. It's as simple as that. So it's not charity, because it's not only good for them, it's actually good for us. There is no way. I mean, look at polio and other things, right? Everybody got a vaccine. That's why we ended it. That's why we ended it. And here we are not. And we keep having countries like Africa and many, many others where a very small percentage of people, right, have received all vaccines. And where 1 out of 4 healthcare workers, like this is people working with people with COVID, 1 out of 4 have been vaccinated in many of those low income or low resource countries. So this is why you hear people speaking about the issue of vaccine equity or vaccine justice. Is the same concept, right? And why we will continue to have variants. What people don't connect the dots is that these variants will become every time a bit less likely, a bit less treatable with the vaccines, right? Or less reactive to the vaccine, right? It is clear that for example, let me give you an example actually. Why did they call people that have two AstraZeneca already for the third booster? They were the first. And please know that if you had AstraZeneca for the first 2 vaccines, you better go and get your boosters. It's already clear that Omicron does not respond to AstraZeneca alone. That's why the third booster is, right, an mRNA vaccine. So will it come another variant that will be even less reactive? Well, if we keep waiting and playing with it as if life is back to normal, like when you see some of the things that you see in the malls or anywhere, right? Anywhere, or families all getting together without having seen one another before, without doing the rapid test. That's where the rapid test is so important. You know, I hope that the choirs that go to church, each person gets a rapid test before they go in, or that they require, because it's not a requirement. If you remember, for churches, as is for synagogues and mosques and anything else that we go, you do remember it's not mandatory, right? So I think we need to be very, very wise in the congregations or places that we belong to educate our colleagues, to educate people. I still see people, and I'm sure you all see, with the mask, not like this, but with the mask here, the nose out. Well, the nose is the one that carries the virus the most, right? And that has been known for a long time. So some of that, I do believe, has nothing to do with anti-maskers, guys. Has to do with not having the education, not having someone that can ongoingly educate, and people feel uncomfortable. People feel uncomfortable. When I was in one of these eye clinics the other day, there was a gentleman waiting for his wife. And I thought, this is weird because my husband is waiting in the car. Why is he waiting here? And on top of that, he had the mask to here, right? And so 3 receptionists, none of them saying a thing because all feel uncomfortable. And I did say to the gentleman, you know, you really need to put your mask all the way. And not because of me, because I'm with my N95. So I'm comfortable, but you still should do it. But my colleagues here, the people looking after us, they are not. They have these masks that are insufficient for this virus. Oh my gosh, I got it. Did I get it? So picture this. If you are not a health professional, if you are a position that is, you know, the receptionist somewhere, or, you know, your job depends on those clients, et cetera, et cetera, et cetera. People don't take issue. The same happened to me in the supermarket, and I'm sure it has happened to all of you. People feel very uncomfortable calling the attention, even if it's in a nice way. They feel very uncomfortable. So we need to take it on seriously because this thing is with us for some time. We can go to the next one unless people have questions about the issue of vaccine justice.
There is a question, Doris, and maybe it's getting to what's on the slide right now. But the question is from RV. What are the main barriers to providing the vaccine to low-income countries or continents like Africa?
Money.
I have
money
served in...
and greed. Money and greed. There is nothing else that I can say but money and greed. You may want to pull at some point, Susan, my first blog where I wrote about vaccine justice way at the beginning of the pandemic. Yeah. Because I called for the Prime Minister to follow the US on doing away with patent. If we didn't have patent, so what do you need to produce vaccine? You need not to have a patent protection, right? So you know how to do that. So that's the how. You need a facility, right? And you need people that can do the job. Well, number one, they could be produced, I mean, take India. India is producing for everybody else. AstraZeneca, right, was produced in India, I believe, right? If I recall. And like that, many things could be produced in less well-resourced countries for everybody. And if we didn't have patent, I'm sure even some here or in the US will produce for those countries. So it's purely who do we align with? Who we mean, I mean, who the powers to be in the well-to-do countries align with. So it's the issue of patent, it's the issue. I think that's one of the key issues. But also, look at many vaccines have been thrown away, guys. The US, millions of vaccines because they passed the deadline. And also here, right? So what is preventing that? I mean, it cannot be only planning. The second piece is, like in everything else, we first think about ourselves. Instead of doing the we do the me, right? And so we need to, I used yesterday, there is a hashtag that is we not me, right? We not me refers to us as a person, right? I mean, my right, my body. What do you say about a few nurses that decided that that's the way? It's my body. Well, it's about the me, not we, right? But the same applies then to communities. When you look at what happened in Peel at one point, by the way, they're doing fantastic now. They really, the chief medical officer of health is fantastic there, right? How they turn things around in a community, very compromised community, and kudos to the public health unit there and to everybody, right? This is what happens when you turn into a we, not me, right? You can solve these issues. And the same translates between countries, right? This is no different, colleagues, than climate change. Many of us, well, I shouldn't say many of us will not see it because we are seeing it, what's happening in BC, what's happening in so many parts of the world and here at home, right? But watch it 15 years from now, I don't know what will happen in the world with climate change, which very few are talking now, right, about that. But these pieces are connected. They're all connected, guys. It's about what type of society people want to have in the future and the fantasy land that people think that they can live in their little mansion by themselves and everything will be just fine and the rest of the world, well, whether it's in their community, their country, or the world. But it's fantasy land, you know, it's fantasy land on climate change, even more so than on the vaccine. But all in all, it's the same. That is the barriers. There are no other barriers now. There are no other barriers now, for example, even here at home, to not be giving the boosters to everybody. We have plenty. There are no There are no barriers to both giving to everybody the boosters and helping other countries to get at least their first shot and hopefully their second shot, so we can start to suffocate. Remember when at the beginning we were talking about suffocating the virus before the virus suffocates us? In many ways, the virus has won the battle, right? Not in terms of only killing people around the world, right? But in terms of the life that we are having compared to if we didn't have this virus. So the virus continues to laugh, and the question is when we will wake up, right? That is one world at the end of the day. So I don't have a better answer, Susan, because that's the truth.
Yeah, thank you. Well, that's really, yeah, that is the truth. And it comes down to some simple things there. So Doris, before you leave, maybe I can ask one question. Then there's also a note that I sent you if you could look at as well. But this question is from Mary. Yeah. Why does testing cost money for those who wish to travel outside of Canada, and yet Canada continues to allow people to come into the country who are not properly tested?
Oh, this is interesting what you ask. I like that idea, Susan. Okay. Let's do that. Susan, okay. I had this one time in Spain. Did you hear ever about that?
No, but people don't know what I wrote.
I will tell them, and we keep the question for after. Okay. So Susan said to me, would you consider doing your interview live as part of the webinar as a learning opportunity for participants? Yes. Yes. So I will send you the link. But the thing is this, I one time was in Spain and they put me with this amazing, amazing reporter that came to interview me, and I thought it was an interview with him alone. They had the entire auditorium with the nurses, the full auditorium, and it was live. It was the hood. It was really fun. So let's do that. So I should send you the link.
Okay.
So you can put it for people, but we should ask the reporter. Well, we will ask the reporter at the beginning. I think the reporter will have no issue. That's my view. And it's taped, it's not live, so otherwise would be even better. But that, I think we should say we will allow only people that show up for real tomorrow. So I put the link, we have 5 minutes still. But let me tell you what's tomorrow so people know. And no, I'm not putting it as a condition, but it really will be good if you join tomorrow. So today the interview is a completely different topic. It's about the shortage of nurses in Kitchener. It's a CTV interview. It goes to tape. It means it's not live. They will air it likely this evening. I don't know. We will ask. And also it's about if the vaccine is what is creating the shortage. So here you go. You will hear what I will say, which you can guess. And then the other thing is that tomorrow what we are doing, and you will hear me say that in the interview, is a press conference at 12:30. And Susan or Irmagine, if you can ask the link from Victoria, although Renee, you may have tweeted already, did you?
Yes, I have tweeted.
I am sending it then. I'm sending it to everybody. So please join us tomorrow. I will put it, Susan, for you. I will post it in the Dropbox now. So I save you time with that. And it will be really good if you can join us tomorrow on this, because the more nurses that can be present, the better for the interview. That's number one. And second, it's not coming, yes. And second, because you will hear what's next, and we will want you for sure involved in helping us with that. So here is the link for tomorrow for everybody. And if you tweet, please, oops, it's not going, no. If you tweet, please retweet it. We will appreciate if you retweet this tweet. I already did, Renee, So here you go. We are going to get a lot of more tweets now from everybody else. So that's for tomorrow, but tweet it today.
Thanks, Doris. So Doris, just a logistical thing right now. So do you want us to invite everyone right now who's in this webinar to your interview?
Well, I am going to call the reporter.
Okay.
First of all.
Because maybe the reporter can join this meeting.
That would be good. That's smarter. That is smarter.
Yeah.
That is smarter. The reporter is probably there already. Let me connect with the reporter.
Okay.
Obviously, it's not answering the call. I'm going to tell Raul to go to there and tell the reporter. That is a brilliant idea, Susan.
Well, we'll see.
Raulito.
Okay, in the time being, in the chat box, there is a link to the tweet about tomorrow. So if people can help spread the word about that, that would be great. And we'll also be just looking at making sure that we've accounted for your questions that are in the chat box. And so Mary, haven't forgotten about your questions, and also Jean and Heather are keeping an eye on the chat box too, so we can all be keeping an eye on your questions and to get back to those afterwards. We will also plan today to talk a little bit more about Bill 124. So if you can just and thank you, Emily. The webinar, the recording for this webinar, we'll be posting it on our COVID portal page, and that's where actually you'll find all 29 other webinar recordings from this series of the COVID webinar weekly, began weekly and then turned into monthly webinars. So all of those are on our COVID webinar portal, and thank you, Olivia, for putting that in the chat box. So thank you, everyone, for adding your comments here. You're also welcome to unmute your line if you have any responses to what Doris has just been speaking about global vaccine access and some of the action alerts around that topic. So you're welcome to speak to that right now as we wait to see what the next steps for this webinar will be.
Susan, did you want to look at a few of the questions that are here? Oh, we're looking at Doris, yeah.
Yeah, I think people were asking, unless, Jean, is there anything that you were wanting to respond to from the chat box?
Well, actually a number of them are comments, like vulnerable people who suffered severe vaccine injuries, who are not able to have future vaccines, depend on others to keep vaccinating. And I think that's the question or the comment around herd immunity. We hear so many people who say, I'm strong, Susan, I don't need the vaccine.
So that is not true, first of all, Irma-Jean, so I can answer it quickly.
Okay.
The herd immunity is a fantasy land of mainly anti-vaxxers. It doesn't work. The immune system, like for any other pandemic, it doesn't work. Otherwise, you wouldn't have the number of people that are getting very ill and in ICUs. Switzerland did that trial already, and then they regretted. Susan, the reporter,
she's not going to go for it?
No.
Okay.
We need to go to Spain for that, Susan.
Okay.
They are game to those things, but
okay.
I love the idea. But that's not to say that we can plan in advance a collective interview at some point for the new year and bring a couple of reporters that like Liz Brown and others that actually, and also advise people, I mean, if they want, yes, if not, not, but they can be either present watching it, and some may want to be part of the interview.
Great.
So I will go there and be back.
Okay, and in the time being, Irma Jima is going to talk about Bill 124, and we can look at the website.
Fabulous.
So that's great. Okay, so just don't mind me for a minute while I scroll back here to the rally, and maybe we'll start there. Irma Jean, if you wanted to kind of talk a bit about Bill 124 and some of the activities that we're doing, and also the website where we're asking MPPs to sign the pledge. So, and any of you who were actually at the rally are welcome to speak about this as well. So I'll turn it over to you, Irma Jean. Thank you.
Oh, okay. Thank you, Susan. And hi, everyone, and welcome. And this slide is a beautiful picture of the action that has been taken really by RNAO, joining in with, I think it's the group was Nurses
with Signs. And Irma Jean, you're not on camera, just if you want to put your camera on.
Okay.
Yeah.
And
great, there you are.
We very happily joined in because it absolutely has been an issue on RNAO's advocacy agenda. So we joined in. Doris was a key speaker at this event, and it was at this event that we began really the countdown. And as you know, there is 1 day left. And part of the advocacy, of course, includes our action alerts, which we have absolutely kept alive from early November until now, with, I believe, now about 9,000 members and others signing. So it's a very active and popular action alert with everybody joining in. And we're really linking this very much to a nursing shortage. The shortage, and I'm sure Doris will talk about, does not have anything to do with any hospital policy around non-vaccinated persons. And it has more to do with nurses being fed up because of Bill 124 and feeling that they are not being heard and not being respected. And we did write an open letter to the Premier. It's all posted on the website. And again, with our key issues identified. And then one of the things we have done, as Susan mentioned, and maybe move forward, Susan, we have called on all of our MPPs to send a letter in to the government indicating that they stand by nursing and stand by nurses and want Bill 124 repealed. Now, at this time, we have no conservative MPs that have signed on, which is no surprise. We have, I believe, 35 from 42 sitting NDP politicians, MPPs. Oh, it's 38 now out of 40 who have signed. Oh, the slides are doing interesting things here, Susan.
I'm just trying, sorry about that. My slides have a bit of a life of their own. But I'm just trying to pull up, actually, Irma Jean, I'm wanting to pull up the website that that shows the full names, because that couldn't. Now let's just see if you can see it. Can you see it all there now?
Yeah, we can see the names of the MPPs, so you can see those in your area who have signed, but really it's almost all of the NDP. And the Liberals, we now have 7 out of 7 sitting MPPs who have signed, which is fabulous, and the Greens 1. So it's frankly all the MPPs practically, but 2 NDP and then no PC. And we're kind of surprised by that because we thought there may be a few who would break rank, but right now it's sitting at 0. And I think, Susan, that's really all I had to say, unless there were others who wanted to comment on the rally action or any action they themselves have taken with the action alert and spreading the information.
It'd be great to hear for some people who had actually attended the rally or who have been taking action, or even comment on why this is important to you. So let's just see if anyone wants to unmute their line and share a little bit about that.
Or write something in the chat box. Yeah. Oh, gee, Susan, the slides are kind of funny. Oh, here, yeah. Someone has said, was there a response from the Premier's office to the letter and actions? Not that I know about, although when Doris comes back, we can ask her, because I know she has regular contact with the Premier.
Okay, Ermagine, are you seeing the slides okay now?
Yeah,
now I am.
Okay,
And Corsita wants to be unmuted. She's wondering how to unmute. Is someone unmuting Corsita?
Yeah, she has to be advanced to a panelist. Can you help with that? Or?
Hello.
Thank you. Yeah.
Hi, thank you. Thanks very much. I am honored to just have the opportunity to say that I attended the rally on the 14th of November. And the reason I did was I felt it was for a cause that's very important for nurses, but it's also a cause that is important just for other people. So it's not just specific issues like so an ONA wage issue. It's not a union issue. It's a health issue. And I felt that day that it was necessary to be there as a representative of a community that we, for various reasons, I am a Black woman, I am a female, I'm an immigrant, I'm a nurse, and there are just many reasons. I have started nursing as a healthcare aide, PSW, they're called now. So I've sort of been through the different levels of nursing or healthcare. And I felt that with Bill 124, it's an insult, it's a slap. I feel disrespected that if we were men or male-dominated profession, this wouldn't be an issue for us today. I look at the way the police officers have historically been treated, and anytime they've wanted something, and I don't know what goes on behind the scenes, but they've been able to get whatever they've needed, including funding. So by putting Bill 124 in place, it's just the most egregious thing that I can think of. It offends me every day that I wake up. And so that was what made me go down there. One of my friends drove me and she stayed with me the entire time. And she's a non-nurse and she felt the need to go because she also felt that she had to support this for the same reasons, which was that it was just not fair on a global scale. So that's all I want to say about it now. And I'd like to thank the RNAO. I'd like to thank the people, Nurses with Sign, who organized it. And just, the idea that we can go down there and have our voices heard was very important. So thank you to the people who organized it.
Thank you, Corsita. And hopefully you will join the press conference tomorrow as well, or help spread the word about it.
Mm-hmm.
Thank you.
Actually, Corsita, yeah. I think some of the comments you made are so important that it's become a really critical issue and a sign. And it was one of the comments that we made during the Queen's Park on the road to the Minister of Finance, Peter Betlenfalvy, when he talked about, you know, certainly this was something that, yes, was happening and don't worry, da-da-da. And we said, listen, this has become a symbolic issue. It's really critical. And it's now become a symbol of how this government treats nurses. And I'm hoping that the whole government heeds that, because it has become a symbol. It's gotten a lot bigger than I think what the government thought it was.
Thank you, Irma Jean. I see that Michelle, Mary, and Naomi have all put up their hands. So I think we're in the process of allowing you to speak, and we'll start with Michelle, please. I'll try again.
Michelle, if you can unmute your line if you want to join the conversation.
Oh, I think Mary said she has no option to unmute. Okay, but that's not Michelle.
Okay, well, Michelle, while you join us in a minute, we'll allow Mary to speak. So Mary, you should be able to unmute your line now. Great.
Hi, thank you very much. I've just been commenting. I totally agree that Bill 124 is a horrible bill. But when I have a conversation with my community and fellow people out there, I'm having coffee in the local Tim Hortons and we just start up conversation. I noticed that a lot of people are really upset about the way nurses are, you know, talking about wages. I think we get a lot more public support when we talk about the care of our clients and our people. I think I'm out in the community right now currently, and I think it's just incomprehensible to me how government constantly says how our people, you will be supported in the community, and people are not well supported in the community. Healthcare has gone down the tubes, and part of that is because we have replaced RNs with a lot of different other healthcare providers. And not that I don't love all of the healthcare providers, but there's something to be said about having your hands and your eyes on patient care and for RNs. So I'm just saying that it's unfortunate, but when we talk about our money and our wages, people aren't likely to listen as well as when we talk about the kind of client care that we should be providing, but we're not able to. Thank you.
Mary, I think that's a very well put comment. Just a couple of responses I would have. First of all, somehow when nurses talk about salary, when women talk about salary, it's a big no-no. Other people can, and somehow it's okay. However, I do hear you, and that's why I think it's important that we always couple this with the notion that it's now become an issue for nurses that is causing them to really think twice about staying in the profession because they're not being respected, and that will cause a shortage and issues for the public. We will no longer be able to support the public in their healthcare needs. And I think you're very right. There has been shortages. We know that we have a gap with the nurse to population ratio being the lowest in the country. So we started this with a gap. And every nurse that leaves due to Bill 124 means that we increase that gap. So you're right. We need to always match it with this is going to be the result for the public so they understand.
Thank you, Regina. I think that's really helpful. It is helpful to me. Mary, does that seem to resonate? Do you think that would help you when you have those communications with people in the community?
Thank you. I think that point is well taken. Absolutely, I agree with you 100%. But you've got to remember that when we put posters out to the community. And when I even look at what you're posting online, those kind of messages are not communicated in signs that say we deserve more than 1%.
Yeah.
What we really need to say is something a little bit different, because we're not communicating it well to the public. I understand those issues, and thank you so much for articulating it again for me. Yes, I agree. Women don't necessarily speak out about how we're paid comparatively to other professions, comparatively to teachers who are more male teachers. It seems that they have more outspoken issues. And so yeah, I agree with you wholeheartedly, but our messaging needs to change because somehow it's not communicated well to the public. Thank you.
Mm-hmm. Mm-hmm.
Thank you, Marion. And thinking about your how you frame a message and what you communicate to who is an important point to bring up. So thank you for that. And Maria in the chat box says that historically nurses receive no pay for their work, and when they do, society make them feel it is not right and that they're selfish. So thank you for that comment, Maria. We have Naomi and then Aaron. So Naomi, are you able to unmute your line?
So Susan, Naomi doesn't have a microphone, so she's passing on speaking. So maybe Aaron and then Katie.
Great, thank you. Aaron, go ahead.
Hi, hello. I had the opportunity to speak with 10 MPPs in Toronto East Riding about this issue. And I think it's very interesting, Mary, what you said, because while I'm a raging feminist and think that we have absolutely every right to request the pay that we deserve, I also feel like nursing has this nuanced idea of this, you know, we are this moral high ground and we will care and that's our duty. And I think that for the last 20 months, that's what people have done. When we've had conversations with the MPPs, we've really framed it about the work that's being done and the impossible burden that nurses are asked to, you know, to shoulder, and nurses saying that they're scared that their family is going to get sick and need care. And I've said that in every call, because I feel like when nurses say to me, what if my kid needs to go to the hospital? I'm scared for the care they'll receive. I think that says so much. I'm very blessed. I've been home with my kid during all of this and I haven't been on the front lines, but I feel like whatever the reason that nurses are leaving, and I think that it is right to request the pay that is commensurate to the work. And certainly what I think nurses are asking for isn't nearly enough. But I feel like just to really highlight I don't know, I think people that I know who don't work in healthcare don't look at this whole thing the way that I do. And the idea that you might one day show up at the hospital and nobody would be able to take care of you is terrifying to me. And I know it could happen. And so I feel like it's this balance of trying to, you know, state that we're in this because we care and we care about our patients, but also, and not try to fearmonger, but to say, this is critical. And I mean, everyone that I've talked to, PC or otherwise, I've said this situation is not going to get easier. It's only going to compound. It's only going to get more expensive. It's only going to get more dangerous. But again, there are people in certain parties who totally agree. And there are other people who say, you know what, the pot of money is only so big. And this is what we can do. And the decision was made before the pandemic. So they didn't change it now, which is insane in my opinion. But it's definitely been it's been received very differently depending on who I'm talking to. So.
And actually, Erin, while you're speaking, I just want to give a shout out to Erin. She says she's not on the front lines, but she's on the front lines of policy. And Erin has just been really a master at planning and in fact, running a number of Queen's Park on the Road events with the MPPs in her region. So thank you.
I have the gift of being a super pest. I'll just keep emailing or calling until you respond to me. Like, thank you.
Before we move to Katie, can we just talk about this a little bit more for a moment? I just moved to the slide about Queen's Park on the Road and this opportunity to meet your MPP, discuss key issues and influence healthy public policy changes this year, the focus being on RN understaffing crisis. And there's a toolkit with, this is an example of what's on the toolkit, of an infographic that can be really useful in those discussions that you might be having. Ermagine, did you want to say anything more about that? Or Erin, do you have any words of encouragement for any tips for anyone else who might want to get involved in this this kind of thing?
Oh, I think we should turn it to Erin, the master.
I really didn't realize I was going to get an ego boost today. I mean, I think that these have been really cool. And if your region hasn't done any, or if they're still doing them and you want to get involved, they're 30 minutes. Most of them are 30 minutes. They're all on Zoom. I've had nurses from our community join in and have said afterwards, I feel like I'm boiling with either anger or sadness or something. And this was something to do. So if you feel like you want to do something else, this is a good opportunity. I know everyone's super busy and super swamped and exhausted, but if you have 30 minutes, you can reach out and find out who your PPAN is for your region. It's really nice to get to know the people who are representing you, to be able to articulate, look, we worked at half staff. You know, the nurses who joined didn't say where they worked, but they said, look, I had to work 8 extra hours on top of my 12-hour shift because there was nobody. Or, you know, the comment about feeling afraid for family members who would, you know, get hospitalized. I just feel like it was a really valuable thing. I don't know that everyone got the message, but I think you still have to get up on your soapbox and scream it. So.
Yeah, and I just put Anne-Marie Morris's email in the chat. If you're interested in being part of a QPOR, please email her. Or Erin, just for tips.
Great, thank you. Can I just, Erin, can I just ask one more thing? Is there anything else that you think was like, that really resonated when you met with MPPs? You talked about, you know, mentioning if one of your family members ended up in the hospital, who would be there to care for them. Is there anything else that you think really resonated that would be helpful for other people to hear?
And I think we talked a lot about, like, I don't know, I called it the moral burden of having to care for patients the way we need to right now versus the way we learned how to. I mean, we talked about Bill 124, but it was mostly like this idea that you know what your patients need, and there's no physical way in the shift that you're given and the resources that you have that you can do it. And so every day you go home feeling like you're failing your patients, you know, you're failing yourself, you miss your family, you're risking your life, you're risking your family's health and well-being. So it's this idea that, you know, to undertake that for such a long period of time, like, it's no wonder everyone's burnt out. Mm-hmm. And so, you know, and the fact that this is not something you can fix overnight, and it's only going to get worse. And let's think about the next 10 years. So, I mean, I don't know. Sadly, and I'm sure you guys can relate to this, until you have a family member who goes through a hospital system and has a tragic event or a real, you know, heavy chronic illness, I feel like maybe it doesn't really click. And then you see what it's like when my dad was in long-term care for many years in the States, and to watch the way the nurses ran around and know that if I wasn't there to advocate for him and do a lot of the work they would be doing, it wouldn't have gotten done. And so, I don't know, I think those personal stories are the best way to articulate it, because we can talk about money. To Mary's point, we can talk about a wage that's fair for our work, but I think it's those personal stories that really, really hit home.
But I think also, Erin, what I found really perked up was when we had, because we try to have not only a political action lead, but an MP, an RN, and a student who actually gives some personal information about, in my experience, this is what's needed for quality care. And now I'm seeing this is happening, which is changing it. And should you need care, this may not be the best that has ever been given. Do you know what I mean? Because we are running on close to empty. So I think it's really important, the personal stories. The other is, Erin, when you had the recommendations that show there's a solution. And I think we tried very hard not to leave our MPPs with a feeling of, oh, there's no answer here. We have solutions in our recommendations that I think are really important to share. And then the other is action for the MPP to write a letter. And the letter's already written. We leave it with them with the 5 solution-oriented recommendations.
Oh, absolutely. We had a nurse.
Yeah.
We had a nursing student come on, and we talked about, like, you know, I don't know if you can reflect back however long you guys have been nurses, but I've been 20 years, and this idea that, you know, you get out of nursing school and you start on a unit where 6 months later or 9 months later, you're one of the most experienced staff, and how terrifying that would have been for me. I had this amazing orientation, and there was a mix of people who were new and people who'd been doing it for 30 years and a lot of people in the middle. And that's how a nursing unit works safely. And we're cheating these nurses, and we're, you know, and the feedback is, I'm going to lose my license. Like, I just became a nurse and I'm scared of losing my license because I'm not in a safe working condition. So we talked a lot about that too, and ways we can support new nurses with orientation, and way we can support late career nurses with giving them, you know, opportunities that don't require as much physical exertion and, you know, demands and things like that, how we can support internationally trained nurses. So it wasn't all just Bill 124. There's definitely a number of things that all work together. We always lead with Bill 124 because I think beyond the money, I think it's the punch to the gut that it felt like for nurses having worked so hard for this long to then have this come in. So it was like the message that it sent.
Great, thank you so much for those, that insight and sharing, you know, what's really worked well for you. And I hope it's encouraging to others to give that some thought about getting more politically involved. So thank you. And for being put on the spot, Erin.
Erin.
Well done. So Katie, thank you so much for your patience. You still have your hand up, so glad it's a virtual hand. And if you can, speak now and share your question or comment.
Yes, hello everyone, and thank you, Erin. It was really great. And I guess my comment is about, I think, Mary's comment about how public perceives us nurses when we're asking for quality of work and quality of pay. And I was just talking to my friend whose husband is a psychiatric nurse, and he's just denied his vacation. He's denied any days off he wants to take because there's no other people to replace him. And when he works as a full-time nurse, he seems to be the only one who's doing more because the other nurses are casual coming in and always rotating, not being sure what to do. And the other full-time nurses are, you know, have to call in sick because that's the only way they can get time off to recuperate. So public doesn't necessarily know these situations. And also I'm wondering to ask any government worker, what are you gonna do if you're gonna be constantly denied your vacation? How would they react to this? And I think just to comment that definitely the real stories on, you know, even on the Instagram, the nurses with a sign really show real stories across Ontario, what's happening. And it's really, really good. But we need more of this media touch for public to understand what's really happening.
You know, Katie, I find that interesting. I was listening to the news, I believe it was last night, and I believe it's the EMR workers they were offered 6%, I believe, salary increase over 3 years. I believe it's 3. And they're not happy, they're not accepting it. They want, I believe, 13%. And it was quite a big media spread about the work they do and how they're called upon and don't exactly know what they're going to face. And it was a very, you know, friendly, EMR friendly kind of a news presentation. And I thought, gee, I really don't know why we can't get that for nursing.
Yes, definitely. We need a little bit more social media, exposure to what's really happening. And through those videos, through real stories, they just, people understand more. For those who are not connected to healthcare yet, like I think Erin mentioned, until you have a family member, until you become an advocate yourself for your family member, you don't understand how difficult it is to navigate through healthcare these days. And you're really seeing real nurses running around. They don't sit for a second. So you can't blame them when you really see how they're working. And that would be great to raise awareness to different parts of population, from young to elderly. And another interesting issue was that, I don't know what reality is, but we've heard to apply for university to become a nurse, the process is so hard and the marks have to be so perfect that it's another barrier for nurses graduation. So I don't know what's your take on that?
One of the things I think when you look at the solutions that we're proposing, a number of them are increasing enrollment in the four-year basic baccalaureate, as well as what are called the second entry programs for those who already have a degree and have a 2-year nursing program. And then the other is the RPN-RN bridging. And for both of those programs, we're understanding that some of the universities take anywhere from only 10% of the applicants to 20%, 25%, or 40% may be the highest. So there is a pool of well-qualified applicants for us to increase enrollment. We need the funding. And then we have identified from pools of IENs, the internationally educated nurses, nurses who have a college registration, are not working in nursing, but are looking for nursing, nurses who are registered with a college, are working in nursing outside of Ontario, are looking for nursing in Ontario, and then other pools who are registered with the college, but not working in nursing, and maybe even not looking. However, with the right conditions, a number of us are fully convinced they could be drawn into nursing, because let's face it, they're keeping their registration. So from those pools, we've identified that there could be anywhere from 15 to 20,000 nurses who could be available if the conditions were right. So there are solutions.
Yes, and if this was made public, that everybody would know, well, we do have these workers right here and now, why maybe we would get a bit more support in that bill.
Mm-hmm. Yeah, and this will all be part of our political platform for the provincial election, which will be released soon. We always release it early so that we can influence the platforms.
Thank you. You know, Katie, one of the things that you just said that really stood out to me is, I wrote it down, that calling in sick is the only way to get a day off. That's pretty alarming. I haven't heard anyone phrase it that way, and that's pretty compelling. You said so much that, so many important things, but that one really stood out for me. So thank you for sharing your story. I think we have gone through all the people who had their hands up, but there might be some other people who wanted to say something just before Doris comes back to us and we go to the Q&A. I know that the chat box, Heather, you've been monitoring the chat box as well. So kind of keeping tabs of the questions and comments, but anyone else want to share anything that they've been doing to be kind of active in addressing the nursing crisis, or what it's like for you right now?
I don't know, Susan, if Shelley might want to make a comment. She wrote in the chat box.
Sure. Shelley, would you like to unmute your line? Mark, how about you? Mark just wrote in the chat box, it'd be interesting to hear from you. I'm just about to get your registration to become an RN.
Hi, I'm Bernadette. I'm using my husband's account right now.
Oh, okay.
It's Suarez, and as I go along with the information and during the webinar, I just wanted to say that there are many international educated nurses here in Canada that are almost on their way to getting their licenses. It's just that there are some things that are not yet in place. But I am currently working as an RPN. I am speaking in behalf of the other international educated nurses that are not able to work in the clinical aspect here in Ontario. But given the opportunity and the chance, they would be very willing to practice their nursing skills, to put all our hands together and try to solve this crisis. Because there are many skills and talents that are put to waste. If we try to gather some resources from other communities like the international educated nurse, I believe that we will have enough manpower to get our hands all on deck with the situation, with the crisis. That's all I have to say. Thank you.
Thank you, Bernadette. Before you you go offline, there might be some other internationally educated nurses who are on the call right now. Is there anything that has worked particularly well for you to get to the point where you are now, just about to get your registration?
Because I think during the times that I started out trying to navigate my nursing career here, I started out as an RPN. So I studied first, and then to finish and get my diploma and have that bridge towards here in Ontario. And then after that, I attended webinars, I do volunteering. I did certain things and did my research in getting through my paperwork here for my RN as well. But I believe that there are many IENs here that has not found their way in, because I've been here long enough to know how things have worked for them. But it's just that tapping through other IENs and letting them know that here in Ontario, they are welcome to help and their knowledge and skills will not be put to waste. And just like me, I'm on the way to getting my RN license soon enough, probably next year, early next year, I'll be getting that. So it's just more awareness and promotion, letting them know that they are capable and we are letting them have the opportunity to help us as well.
And actually, Susan and Bernadette, just
Susan, can you give me video?
Okay.
Go ahead, sorry, Imagine.
Well, I was just going to say in relation to the IENs, and Doris, I'm glad you're back. We have certainly identified that there is a pool of over 7,000 internationally educated nurses that appear to be in a backlog with our regulatory body. And that is one area that RNAO is really looking to take action, that we speed up that process.
That's very good.
And we break down those barriers. Even you, Bernadette, all of the things you've had to do, we need to really closely look at whether that is absolutely necessary or whether that could be in some way streamlined.
Yes. I believe that I have stayed here longer, and it took me longer to get my degree, my license as well. So there must be some challenges along the way for newcomers, there are things that needed to be done. But if right off the bat, they are aware of what to do, and also I don't blame the CNO or the nursing programs that we have here. It's very good. I myself have been through the program and it has helped me very much in my own practice. But if we needed more help during this time of crisis, then we could have made our system somewhat fair and just and easy for them to be on board for licensing so they could help us more. If the situation that the crisis right now that we are experiencing needed more health force, more nurses, there are many, as you mentioned, there are big backlogs. I have many friends of mine who are waiting for opportunities to take the exam, waiting for their safety practice, waiting for language proficiency, because
who's speaking? Sorry.
Sorry?
Who is speaking?
Bernadette. Sorry,
Bernadette.
This is my husband's account. I was in a rush to get in. I didn't change the name.
Don't worry. I just want to make sure everybody gets a chance to talk. And so I wanted to wrap up this question.
Yes.
First of all, Bernadette, I would urge you not to, in the future, give an excuse to anyone, including the college. It cannot be that there are almost 15,000 people waiting to be processed. Last year, about 4,000, almost 5,000 applied and only 1,500 got accepted. It cannot be that the 15,000 don't have the right credentials. It cannot be. I don't buy it. I simply do not buy it. I know of nurses that came from the US. I know an NP now, examined everything, same exam as here. She actually went back. I know an RN, she was featured in the Ottawa Citizen from the US. So it's impossible. What's going on is impossible. And we are going to tackle it. I believe political parties will tackle it during elections too. I hope all of them, because it is absolutely not okay. And RNAO is not okay with that. So I feel very, I feel that IENs out of perhaps, and I was an IEN too, by the way, so we can have a more conversation later on. I feel many IENs feel very compromised to say it as it is because of fear that then it will be repercussions. I feel many IENs soften the blow. And I keep saying, if the 15,000, because I think Imagine is 14,888 or something like that. If we were to do a picture, a collage of the 15,000, many will not look like me. And the ones that will look like me will also have an accent like me. And you know what I mean by that. I absolutely believe that there is an issue of discrimination, systemic risk discrimination here, and RNAO will tackle this. It's not acceptable. It never was acceptable. And as you're saying, given the nursing shortage and the crisis that Ontario is in, is even less acceptable, but never was acceptable. And I know it's difficult for people that are waiting for their license to speak the way I am speaking, but that's the truth. That's the truth. I don't see any other truth. It cannot be that all of a sudden 15,000 people that came from other countries, from programs that many of those programs I know, they don't have what it takes to be a fantastic RN here in Ontario. It cannot be. It cannot be. And it's not happening when they go to the US. So we have a problem and we need to tackle it. Sorry, it's the truth.
Thank you, Doris. We hope your interview went very well and look forward to having an opportunity to participate in a future interview. The chat box has been pretty busy with questions, and I know Heather's been kind of keeping an eye on it. So maybe Heather, while I kind of catch up, you can point out one or two to get us started.
Yeah, maybe we can go a little bit back to some of the discussions we were having just before you left us. And this question is for Erin. She understands the recommendations from NACI for kids vaccine was an 8-week interval to improve protection, but given that there's no actual studies on this interval for kids in this age group, and now Omicron is raging, shouldn't the interval be shortened? All of those half-vaccinated kids will go back to school in January, and she's concerned.
I bet you that they will shorten it. Yes, I think they will. I also think that in the new year, whether it's in January or so, there will be a vaccine for 2 to 5 in the US. It's already ready. In fact, I believe that it has already even been approved in the US. It's under wraps, but I think it will. And I think soon after, come February, we will have hopefully that here, and that will start to put a lot of us at ease, right? Because in the US, there have been a large number of kids hospitalized, and there have been a significant, not huge, but a significant number of kids dying, right? But also it's the issue, and I saw someone wrote here, the issue of long haul COVID. No one is talking in Canada. In fact, in Canada, very little is being spoken about long haul. And it's significant. It's significant, right? And it's significant even for kids in terms of how long it takes them to recover and all that. But for adults, even more, right?
Got another question here about transparency and our capacity to vaccinate each day and what the government is building up to.
Well,
I need to provide 1 million vaccines, and we're doing about 80.
Yeah, but that's not because of capacity. We have the capacity. Look what happened before, right? I mean, again, I would say it reminds me a bit of what happened last December. I don't know if you remember that in December 23 or December 22, I don't remember, but was the holiday. We were in the maybe 23rd. All of a sudden, clinics closed for 2 days. And we thought, what, did the virus go on holiday? And we were outraged. And then Hillier was the person, remember, the guy from the military, and he said, well, no, people couldn't get to the vaccine sites, that's why. And then once it was that got solved because people started to say, no, we want to go, we want to go. Then he said, well, maybe there is not enough stuff. Nothing of that, Heather. We could be rolling out vaccines a lot faster. They could be done in pharmacies. They could be done in the public health units. They could be done in so many places. There is no excuse for that. There is no excuse. And that's why you see more and more of us pushing for that. Because it's the biggest protection we have of at least not crumbling the health system, right? As it is, you will have enough people that don't want to be vaccinated. So at least those that want to, right?
Yeah, absolutely. And of course, we're going to have another big surge of desire for vaccinations.
Yeah.
It's more eligibility.
In the US, they're vaccinated. In the US, they have the other problem, right? In the US, they have the problem. They have so many sites to vaccinate people, and they don't have the people to get vaccinated. So we should go fast because people want. Like the faster we go, the better it is because people are willing. People are willing to go in the evening, going at night, or whatever.
Got another question. This one's from Jeanette. And she says she's wondering that she's currently working right now and conducting rapid antigen testing, and she'd like some reassurance that they're effective in recognizing the Omicron variant.
They are. And, it's not the same as the real thing, but it does show if you have something, if it's unclear, you will go. If it's anything, it may show more rather than less. But when you're, going to visit family and you have no symptoms, no nothing, you haven't been around with people with COVID, I would do that one. If you haven't been with people with COVID at all, like you haven't, so many people are not going into the stores or into the theater or into the whatever, right? So
making them more available to people as well.
Learn from the Mervish and all of those industry, because they're doing every day to people that act and all of them. And you cannot go in without a passport for the patrons, but for the people that work in the industry, everyday testing. Because they don't want to lose the business, right? Enough that one drama happens and the whole season will be probably, people will stop going, who knows, right? So it reminds me a bit about the safety industry for flying versus the safety industry for staffing our hospitals. There is so much we can learn in good times and in bad times from other industries, right? You don't get into a plane today if you don't have a vaccine passport, period. You like it or not like it, don't go. Don't go. Like it's not a must to go to some events. So, and it's not a must to get with family. Now, do I say to my family, don't get together? I said to my sister that had not seen her grandchildren. She lives in one country and she went to another. When she said to me, I really want to go, what do you think? I said, go. Because you also need to balance the risk with the risk of none of us are getting younger. And she has not seen them for 2.5 years, honestly. So, she's triple vaccinated. She went with the mask, didn't take off it for a second, N95. She did the test. She got, you know what I mean? And she's having a great time now. Like, do it safe, right? Do it safe. Do it safe. Like we can't stop life forever, guys. I mean, that's the truth.
No, it is. And trying to find a way through these coming months.
But Heather, that's why we need to do it that is fair for everybody. Not only for the sister that can pay a test, an antigen test, but actually for people that cannot pay. That's the first people we need to think, that then they can go to the pharmacy or whatever place and say, I need 4 tests, because we have enough and because not everybody will want them.
Exactly. I'm sorry, I'm just looking to see, we've got a lot of comments in here around the discussion that was going on with regards to internationally educated nurses, and lots of comments of support there. Also really addressing the needs of our young new nurses and how challenging it's going to be. We've heard this before, bringing them into the work environment. It's been a difficult 2 years of their education, and the need to really be able to support their transition into the workplace in a positive and empathetic way.
So I want to comment a general comment, both because I had this long conversation yesterday with a colleague about this, and also because I have lived long enough, touch wood, in several countries, touch wood, with war zones and with SARS and with you name it. And I say this, and my colleague said she will use it in the classrooms now. This is the worst time for nursing, and this is the best time for nursing. When I had the other day, which was music to my ears as a woman, right, as a feminist, a new grad that still had not received the exam, since then she passed the NCLEX, that said, I have 7 offers, can you help me? I didn't know her. Can you help me to see which one of the 7 I should choose? It's the best of times. You know, so for the younger generation, will it be rocky this next year and 2? Yes, because the dust needs to settle. But you will have more opportunities than anyone had to choose and be picky. And in that, I would say, like all my colleagues here that are seasoned will say, choose wise. Choose a place that deserves you, not just a job because you need the, you know, keep your ideals. Choose a place where you ask the tough questions. If you have 7 interviews, you can ask, what will be my mentorship program? Are you able to keep mid-career nurses and seasoned nurses so they can continue to mentor me? They will, first of all, you are going to get the job right away, number 1, because any seasoned nurse would love a new generation nurse that wants to learn from the more seasoned ones. That's number 1. And you will get to understand the work environment and choose wisely. Really choose wisely. And then remember, if you make the wrong choice, you are going to have other opportunities and you will be able to move. But do not move from one to another, like all the time. And even the issue of compensation will get better, guys. So don't jump into this agency bandwagon right away. If you want to do some agency shifts on the side, do it. Don't do it as your career because that's not nursing. I'm sorry. It's different, right? It's nursing for a shift. It's nursing, you know, for several organizations. It does give you a skill set of being able to fluidly move from one organization to another, but don't make it your career. You know, I don't know, maybe I'm old fashioned on that, but I think when you work for it's like we often spoke with my colleagues in the past on and off when we had time to speak about things, about, you know, being a consultant and working in a project here and there versus being in a workplace that you see the whole process is different, right? When you see the same patient every day, if you know what I mean, it's different. So if you need, because you will be attracted when you hear, when the young generation will hear that in a, you know, in an agency you get double the money, of course they will get attracted. So, you know, do a few shifts here and there, but don't make it your career. Make your career a good workplace so you learn nursing and you enjoy nursing in its entirety. And then you can always decide later on.
Great, thanks, Doris. I think we've got somebody with their hands up, so I'm going to turn it back to Susan now. Thanks.
But if other things different, by all means, you know, jump in, guys.
Thanks, Heather. So Alexandria, would you like to speak? You can unmute your line and share what's on your mind. It's for Alexandrina, I think. Yeah. Give you another minute. And okay, maybe while we're waiting for Alexandrina, I just wanted, Josephine, it's interesting you wrote in the chat that your team recently submitted an article on COVID-19 mental health stressors of healthcare providers. And do you want to just say a little bit about that? Thank you for putting the link in the chat box, because that's some of the work, obviously, that RNAO has been focusing on for quite a while. So Josephine, if you wanted to say anything about that, I'll just give you a chance.
Sorry, I don't have microphone.
Okay. All right, so maybe what I'll do is just point people to look in the chat box for JW, Josephine, who put the link to an article that is the acronym PACER Interventions, Pandemic Acceptance and Commitment to Empowerment Response. So that looks interesting, looks like an interesting read. And so thank you for sharing that. And then I just wanted to go back to a comment just a little while ago. And it was, let's see, from Heather at 2:45. And Heather was saying, I'm going to read this, Doris, and it seems like there might be some words of encouragement that you'd like to offer. So Heather says, I feel that the most pressing issues amongst all of the pressing issues is the well-being of nurses. It's truly a crisis. Nurses require mental health support. And in addition, many of the areas are working extremely short, which we've been talking about. Why is this happening? My theory is that the work conditions are terrible. There is a blame culture that exists. Nurses, now this is the point, Doris, that I think you might want to speak to. Nurses have no power or little power to change things. It is the same old thing that has plagued nursing for years. The only difference is that now we're in a pandemic. Without immediate action in this area, there will not be the nurses to care for others. So maybe, Doris, you can respond to that, please. Oh, you're muted, Doris.
Sorry about that. I am saying I will, and anybody else that wants to pitch in, including you guys, but also colleagues attending. I don't think it's the same. And I say it with really concern. I don't think it's the same. I wrote one of the columns, if you can look at my column, the one that I wrote about the 3 phases of nursing during the pandemic, and I will write a future one on that too. I think it's worse because of the pandemic that has been so long. So I do think definitely the crisis is worse. I think social media had made it more visible. I think women have a lot of more opportunities. I think young people are not willing to put up, or older people. Like the pandemic has shaken people, period, right? Not just in nursing. We will see that in human resources in general. The pandemic has made people reevaluate life, right? Not only because they had time to reevaluate life, but when you cannot see anybody and you are, you go to work or you are working 24/7, or you go to work and then are at home, and it's so long, it shakes you up, all of us. I don't think anyone has not been shaken up. And the opportunities are way more. The opportunities for those that have skilled work, right? Or educated work, however we want to call it. The demand will be so high, right? That in a sense, it makes it easier for you to say, you know what, I'm going to quit because anyways, tomorrow I can find a job. And you can, and it's true, right? Or I'm going to quit because my colleague just told me how easy it is to get into the agency and I make double the money. And it's the same skill set for an ICU, regardless of where. So why do I need to put up with that? And I can say yes to this shift because I'm available and not to the other. So it makes it easier to pack and leave, right? And I don't know where all of this will settle. For the first time in my life, I don't know. I always know where things will settle. One thing I can tell you is that the new generation will have it good, in the sense of a feast of opportunities. You know what I mean? A feast of opportunities, whether in this country, whether in another, whether back in this, and moving is way easier than any time before. That's also true, right? But I don't think nurses are disempowered. I think workplaces or the system sometimes disempowers nurses. But actually, I think nurses are pretty powered up because they pack and leave. So that means they are powered up. They know that I give you an example. I don't know, we should bring Lindsay, by the way, as a speaker at one point, the one we did the podcast with her. Right, mid-career nurse, 15 years in nursing, packed and lived, and likely will go back to nursing at some point, I hope. Amazing nurse, loves nursing, loves patient care, loves to work where she worked. And when the CEO, I connected her with the president and CEO of that hospital. And when the CEO then called her very quickly to speak, said, the first thing I did is go and speak with your colleagues. And my gosh, they love you. They love your work. And what do we need to do to have you back, right? This is what nurses will encounter. I would have this advice for those of you that are mid-career or late career and are thinking, should I quit or not? It's your decision, nobody else. You absolutely need to look at your health first. You absolutely need to look at your health first. Yes, of course, the health of Ontarians. Yes, of course, the health of your organization. But without your health, there will be none of the other. So that's number one. And I said with that most seriousness, because everybody has a different range of what you can handle. Number two, if you quit, or you, and quit is a horrible name. If you take a break, or you decide to live for a while, or you even don't know if it's a while or forever, do it in an elegant way. And I would say this to anybody in any job, and my colleagues at RNAO, my gosh, they know it. Do not, unless you are in a crisis, do not pack and leave and give them 2 weeks, I'm gone. That place will not want you back, and nor should it if it's a good place. Do not, because it means you don't understand the seriousness of the situation. So you know what you want, you think you need a break, etc. Sit and talk with the manager. If you think that the manager is not the right person, sit and talk with the chief nurse. And if you think the chief nurse is not the right person, go and call the CEO and president of that hospital. Because if you think the manager and the chief nurse is not the person you can talk, already there is an issue. And you should talk with the president and CEO. We need to understand that you go to the manager, hopefully, and in many cases that manager is as shaken as you. So think that, right? These people are under enormous, enormous stress. The managers, the chief nurses, the presidents and CEOs, the hospitals, the nursing homes. Home care, needless to say, they don't have nurses. They don't have nurses. It's the poor cousin in the corner now more than long-term care. So be mindful of the system that needs you. But number one, and I am not a person that acts on what preaches many times, but my staff saw me the other day when I thought I had something serious in an eye. I left everything and I went, right? You need to know where you draw the line, because no one can draw it for you guys. And your health cannot come to a breaking point, because there is work, there is also work family, they need you, but there is also your own family, and there is you, and the world needs you and deserves you. So, you know, I'm not being selfish, I'm never. I just am seeing what's happening, and I want to make sure you look after yourself first, because if not, we will not have you healthy to look after others. I don't know, and do I have hope that the future 2 years from now would look better? Yes, yes, because nursing is not going to disappear. Will you and everybody of you be working? Maybe yes, maybe no. Maybe you will continue now, or maybe you will, you know, take a break, or maybe you will decrease the number of hours, or maybe you will increase the number of hours. But don't do it because others are pushing you. Do it because you can handle it and because you want to do it. Don't feel pressured by peers. I learned about the situation the other day, and I don't know if the person is in this call or not, it doesn't matter, but I will tell the situation because it was what I hear in many places now. So 20 minutes before the shift ends, they're about to receive about 20 new admissions in this specific unit. One of the nurses says to the charge nurse, can you stop the admissions, please? Because honestly, we work without break. We work without this. We work without that. We just need to go home in 20 minutes. Can you stop them for 20 minutes? Because there's no way we can leave the new shift to deal with all the admissions. The manager calls the supervisor comes to the unit. The supervisor says, of course, I cannot stop the admissions. We cannot stop the admissions. We cannot say to people, don't come. But we cannot do it anymore. And then the kerfuffle starts, right? The person says, okay, I'm quitting. I'm not coming anymore. Then one person turns into her and says, well, you are quitting. It's because of you that we are in the travels that we are. And that's exactly where I would have stopped it right away and say, no, it's not because of her. It's because of the system. It's not because of any single nurse that we are in the mess that we are. It's because of a pandemic that even in the best of all cases, even if everything had gone perfect, it would have been a hell of a difficulty. And on top of that, we have acted too little, too slow, at least on the first 3 waves. So nurses carry, and doctors too, and artists too, the brunt of it. But nurses are there 24/7, so the brunt of it, right? And then on top of that is that this bill, and we never took the bill. My colleagues know we didn't take the bill at the beginning, guys. When the bill was put in place, RNAO said, this is a business of FONA. We will stay out of it. But the pandemic came and that changed everything. The moment, if I had any power, or if someone else would have been the premier, I'm sorry to say this to the premier, and I will say tomorrow, likely they would have said to nurses, because you're heroes and you're acting and behaving like heroes, we will treat you as such. And that bill is gone. And that should have happened on wave 1, not even on wave 4, which we are now. So that bill, wave 5, that bill needs to go because it's, you know, I keep saying it reminds me the flag that we go in during Pride Day. That's a pride, that's a happy flag. This is a flag, the flag of Bill 124. It honestly looks ugly. It looks so unfitting to a profession that has given it all. It just looks so unfitting. And I mean, I have tried to convince the premier of that, unsuccessfully. And I probably know why, but it doesn't matter to me the why. So that's why I think our colleagues need to also think about themselves also.
Thank you so much, Doris. I think that's a really powerful and important message for all of us, and glad to hear that you dropped everything to take care of yourself, because we need you.
To learn that floaters are floaters and you do nothing with floaters. So for those of you, no, but there are signs that you need to watch for.
Yeah, thank you, Doris. So I've just put in the chat box the link to the action alerts if you haven't had a chance. It's 3:59, Doris, so we do need to bring this webinar to a close. This was our 30th webinar of the series, can you believe it? And the final webinar of 2021. So just thank you all so much for attending today and sharing your stories and taking the actions that you've been involved in. And again, there is the press conference tomorrow. So please watch for social media, be active in tweeting about that, and participate tomorrow. Anything else, Doris, that you want to say as a final word?
So number 1, I put it there, take good care of yourselves, not only your families, not only your friends, not only the neighbors, not only the workplaces, not even only the cookies that you're making, but that person you. Take a mirror, look at you, and say you deserve it. Number 2, stretch yourself as much as you can, but don't break the rubber band, right? Because no one can repair it but you then. And number 3, happy holidays. Hopefully you can get some time to just be, just enjoy, just do whatever is it that you want to do, even if that is nothing. So Merry Christmas to all of you, and happy holidays, and thank you. Just thank you. Thank you for being nurses. Thank you for being who you are. Thank you.
Bye, everyone. Thank you. Take good care.